Hello, this is Ken Harlan of Ozarks Capital Funding, and welcome to part 2 of the Dental Expert Advisory Series and my interview with Debbie Seidel-Bittke of Dental Practice Solutions.
Another thing, too, at least from my standpoint, I've become more fearful of going to the dentist than I did my eye operation because of fear of pain. So, I mean, is that part of the mix, too, they're concerned about undergoing a great deal of pain?
Yes, and that's one of the barriers that I was talking about that we recognize, and I actually have a specific chart with these 4, you can call them quadrants, and we're making notes as we're getting to know that patient. Maybe on the first patient call, John Jones, who just called Dr. Goodtooth, mentioned that he hasn't been to a dentist because of this fear. So it's noted right away, and we have a specific form that helps us to communicate so that there's a yes to the patient case acceptance.
So it sounds like you really try to analyze the patient up front, kind of get an idea of what they're all about, and it enables you to communicate much better to the patient, alleviate their fears and stresses.
Absolutely, Ken. That is my goal.
Well, Debbie, you're embarking on a new project which will help dental practices assess their business from the top down. Can you give us some detail on what this is all about?
Well, if a dentist sees a need to increase profits or they want to effectively increase patients' case acceptance, I, along with my team, have developed a team approach in the dental office to capture this untapped potential. And I have personally put together, along with my team, a 40-week process which eliminates downtime for a consultant to work in the practice. You know, when a consultant comes in, it costs a lot of money, Ken. You know, the doctor usually pays for my travel, airfare, hotel room, and usually they get me a rental car. So that's like $1,000 at least. And then take away or put into that equation having to take some downtime for patients or having a consultant there with patients in the office. We have eliminated this by having an online web portal so that there are many tools available to the dental practice right there at their fingertips. A coach is assigned to the dental practice, and each week the dental practice could be the hygiene team, it could be, most of the time it will be the doctor and or the office administrator. They'll meet for an hour coaching call. And I also have personally written a 200-page manual so that the dental offices participating in this 40-week plan can follow a step-by-step process to accomplish their goals. In the beginning, I personally provide the doctor with a 7-step analysis, which takes me about 2 weeks, and I find the dental practice's untapped potential, and it's for their individual practice. But then through our personalized coaching each week, we are able to guide that dental practice to increase their potential, their profits, their productivity, and effectively communicate with patients. So the end result is a happy patient. They've said yes to the treatment, and they're so happy they're also telling everybody else in the neighborhood and at their office where they work about this doctor. All the tools, scripts, forms, patient letters, there are team activities, etc. These are tools that are all at the office's fingertips through the web-based portal, as I mentioned. My team provides the dental practice a beginning point analysis, a midpoint, and an end point consultation, along with a plan of action for success for that individual dental practice.
So, in other words, you're able to, through this analysis up front, you're able to determine maybe the strengths and weaknesses of the practice, and you'll know what areas to focus on for improvement.
Absolutely. And during that 40 weeks, for example, it starts out with leadership. One of the things that I noticed right away through my 11 years of consulting with dental offices is that doctors have been trained to be a technician. And what they didn't realize when they were in dental school is that they're also a business owner. So the first 2 weeks, I'm working with the doctor and just trying to identify and also build on their leadership skills because, as you mentioned, I have a program that's top-down, and I think that the doctor needs to be very involved with the dental practice, not just come to work and be a technician.
I'm not sure that they teach that enough in dental school. No.
They don't. And I was telling you earlier, I started teaching with Professor Jack Connolly. You know, the University of Southern California a few years ago went to problem-based learning format, and they cut out that practice management lecture in the course. A lot of these schools aren't teaching that.
What's the best way to contact you, Debbie?
Well, I have a website, and we're changing that because we're going to be putting up the information. So I want it to be that people can go to this website, dentalpracticesolutions.com. And possibly when they look on the website, they'll see an example of this web-based portal. And so they can take a look around. We have many programs that we offer, but that's our newest one is the 40 Weeks web-based portal system. And also they can reach me at Deborah@dentalpracticesolutions.com, or they can pick up the phone and give our office a call at 503-970-1122.
Okay, well, Debbie, I want to thank you for taking time from your busy schedule to talk to me today. I'm sure that many of the listeners will find this to be a very useful and informative interview. So thank you very much.
Thank you, Kent, for having me. It's been a pleasure.
Ozarks Capital Funding is the only source you will need for dental practice financing. We offer loans for practice acquisitions, equipment, renovations, and working capital. Check us out at dentalpracticecash.com.